Rests and rest seats. Today we will be dealing with the definition of rests and rest seats, functions of rest, and the types of rest, namely occlusal rest, lingual rest, and incisal rest. So, what are rest? Rest is a rigid extension of a removable dental prosthesis that prevents movement towards the mucosa and transmits functional forces to the teeth. The prepared recess in a tooth or restoration created to receive the occlusal, incisal, cingulum, or lingual rest is termed as rest seats. What are the functions of rest? The primary function of rest is to provide vertical support for the partial denture. Second is to direct the forces of mastication parallel to the long axis of the abutment teeth. Rest maintain the components of RPD in their planned positions. It prevents food impaction. Also, it prevents tooth migration. What are the types of rest? Based on the relation to direct retainer, rest can be of two types. First is the primary rest and second is secondary rest. And based on the area of placement, it can be occlusal rest, lingual rest, or incisal rest. What is a primary rest? A rest that is a component part of the direct retainer unit is termed as primary rest. A secondary rest is additional rest that may be used for indirect retention. So we will be dealing with occlusal rests. They are seated on the occlusal surface of the posterior teeth. The outline of the occlusal rest should be roughly triangular with the base of the triangle located at the marginal ridge and the apex towards the center of the occlusal surface. The rest seat should occupy 1/3 to half of the mesiodistal dimension and half of the buccolingual width of the tooth measured from the cusp tip to cusp tip. The angle formed by the occlusal rest and the minor connector should be less than 90 degree in order to direct the occlusal forces along the long axis of the tooth. If the angle is greater than 90 degree, it will not transmit forces vertically. Instead, it will create an inclined plane effect. This inclined plane effect can cause slippage of the processes away from the abutment teeth, and it can cause orthodontic movement of the abutment teeth with concurrent pain and bone loss. The deepest portion of the occlusal rest should be in the center of the preparation. The occlusal rest should be at least 0.5 mm thick at the thinnest point, and it should be 1 to 1.5 mm thick when it crosses the marginal ridge. Next is the lingual or cingulum rest. These are seated on the lingual surface of the anterior teeth, usually maxillary canines. Lingual rest on incisors are rare. Their main indication is missing canines. In this instance, multiple incisors should receive lingual rest to distribute the stresses over the number of teeth. A lingual rest is preferred to an incisal rest. It is just because lingual rest is nearer to the center of rotation of the supporting tooth, so that it doesn't tend to tip the tooth. In addition, since the lingual rest is confined to the lingual surface of the anterior tooth, it is more aesthetically acceptable. It should be V-shaped when viewed from the cross-section. From the lingual aspect, the outline of the lingual rest should be crescent-shaped. It should form a smooth curve from one marginal ridge to the other, crossing the center of the tooth incisely to the cingulum. And the deepest point of the rest seat should be over the cingulum. What are the advantages? It provides improved aesthetics, and because of its configuration, it is less subjected to breakage and distortion. A cingulum rest is located closer to the rotational center of the supporting tooth and do not tend to tip the tooth. What are incisal rests? These are seated on the incisal edges of the anterior teeth. It is least desirable, and it is just because these are unaesthetic. Also, it interferes with occlusion. These rests are located far from the rotational centers of the abutment teeth, and hence it may be damaged by tipping or torquing forces. So because of these reasons, incisal rest should be considered as the last resort. Mostly it is used on mandibular canine, rarely in maxillary canine and incisors. These incisal rests are mostly placed near the incisal angle of the abutment teeth. It should appear as a small V-shaped notch, and it should be located 1.5 to 2 mm from the proximal incisal angle of the tooth. And the incisal rest sheet should be approximately 2.5 mm wide and 1.5 mm deep. Thank you.